The measles have dominated mainstream media coverage recently, especially as Ontario experiences what is being framed as a surge in cases. Ontario tackles the biggest measles outbreak in decades, reads one headline, and measles cases spreading in Ontario as people turn against vaccines, another. It's important during this to question whether or not these headlines are truly reflective of the situation. Let's dig in. Anyone born before 1970 likely remembers measles as a benign childhood infection, a rite of passage, if you will, like chickenpox, where parties and sleepovers were often followed by a few days of fever and rash. Now, I did a more comprehensive report on measles at this exact time last year, when the fear was similarly ramping up about the infection, so please check that out for added context. In terms of the infection, measles symptoms typically begin with a high fever, followed by cough, runny nose, and red, watery eyes. These early signs are soon followed by the hallmark measles rash, which usually starts on the face and then spreads downward across the body. It can take 2 to 3 weeks in some instances for measles to run its course, which is obviously a major inconvenience for parents trying to keep up with the hustle and bustle of the rat race in modern times. While measles can lead to life-threatening complications like brain inflammation and pneumonia, it was documented that even in 1960, which is 3 years before the measles vaccine was licensed for public use, deaths in the United States were steadily declining and low. While the mainstream media and pharmaceutical interest-captured medical profession says that the best way to prevent measles is by getting vaccinated, no one discusses how a 2-dose regime of vitamin A is an effective way to decrease the chance of measles complications and expedite recovery. Surprisingly, even the government of Canada recommends this simple solution. You just really have to dig for it. And it doesn't appear in any of the recent public health statements on the matter. No, instead of promoting this safe, effective, and inexpensive supplement, mainstream media and public health seem to conveniently ignore it and instead blindly promote vaccination above all else, even though the 3-in-1 combination measles, mumps, rubella vaccine called the MMR, as it exists today, has the second highest vaccine adverse events incidences reported in Canada. Those numbers span from January to June 2019, according to Statistical. But no one wants to talk about that. Another thing that no one seems to want to talk about is the fact that the MMR package insert itself acknowledges that the vaccine can cause a measles-like rash. But of course, they don't actually call it the measles, because if the vaccine causes the very thing that you're trying to prevent, who would want to take it? And since the measles component of the MMR is a live virus, it has the ability to shed, which means that a small amount of the virus can be released from the body, from the vaccinated individual, and then potentially spread to others. And this, of course, happens particularly in the days following vaccination. This prompted a freelance science writer named Mary Bates, who has a PhD in psychology, to write this piece titled "Differentiating True Measles Cases from Vaccine Shedding." She begins by sourcing a study from Nationwide Children's Hospital that found the measles component of the MMR can shed up to 4 weeks post-vaccination, which also concluded that the frequency at which detection after MMR occurs in this patient population really highlights, in a measles outbreak setting, the need to distinguish wild type versus the vaccine strain in terms of PCR. Bates reiterates in her article that the vaccine contains live, weakened viruses, viral genetic material called RNA, that can be shed into the body, making case classification difficult. She goes on to explain that recently immunized individuals may have side effects from the vaccine that look like symptoms of wild-type infection, as well as detectable levels of measles vaccine RNA. In 2022, a measles outbreak in central Ohio led to 85 cases, and Nationwide developed a PCR test to detect both vaccine and wild-type measles strains to help with rapid diagnosis. But what they found instead was that about 1/3 of children tested within 30 days of receiving the MMR vaccine had detectable measles vaccine strain RNA in their samples. Naturally, they still went on to conclude that this does not mean that the MMR vaccine gives children measles and that the MMR is a highly safe and effective vaccine. Meanwhile, here at home, the London Health Sciences Centre in southwestern Ontario, which is one of Canada's largest acute care teaching hospitals, has introduced strict visitation policies reminiscent of those seen during the COVID-19 pandemic, driven by this heightened fear over measles. For pediatric areas, neonatal intensive care, obstetrical, and postpartum care units, only one support person can accompany the patient. All parent and caregivers need to be screened before entry and must provide proof of measles immunity or wear an N95 mask at all times. They say that proof of immunity includes a certificate showing 2 doses of the MMR vaccine, those born before 1970, when there was still robust natural immunity, or blood work results that show antibodies to the virus. No siblings, other family members, or friends will be allowed to enter the hospital, and that exceptions can be made by each patient's care team on a case-by-case basis. But is London Health Sciences actively monitoring for things like vaccine shedding and measles-like rashes, which, if the nationwide children's hospital study results are any indication, are expected to occur in about 1 in 3 individuals who receive the MMR, while their vaccine requirements and patient restrictions will surely prompt more people to be out getting the live virus combination vaccine. I reached out to the Media Center for clarification on how LHSC is monitoring and managing potential risks from recently vaccinated individuals in these restricted units. Specifically, I asked what steps the hospital is taking to ensure accurate diagnosis amid the current situation and how they are addressing the potential confusion between measles-like rashes caused by vaccine shedding and those caused by wild-type measles, especially as these strict visitation policies are being enforced. No one responded to my inquiry. So how prevalent is measles, and is this hysteria warranted? Well, measles cases in Canada fluctuated from 83 in 2013 to a peak of 418 in 2015. They declined to 1 case in 2020 and none in 2021. Cases rose to 113 in 2019, 12 in 2023, and 141 in 2024. As of this year, there have been 224 cases, still far lower than that 2015 peak, and no one wants to talk about the 751 cases in 2011. Notably, in 2017, there were 45 cases, over half of which were in fully vaccinated individuals, and many cases were actually imported into the country. This shows that the measles being a historically cyclical infection still holds true today, as the CDC highlights epidemic outbreaks occurring every 2 to 3 years. The reality is that measles is often oversimplified and sensationalized. Measles was a once common childhood illness with mild outcomes, aspects that were significantly impacted by improvements to things like sanitation, nutrition, and antibiotics before the vaccine was licensed and introduced in 1963. Today, important factors like vitamin A's role in preventing complications and vaccine shedding are often overlooked in favor of pharmaceutical interests. While measles remains relatively rare with occasional cyclical outbreaks, the current hysteria fails to reflect reality or offer reassurance in the context of modern infections. For Rebel News, I'm Tamara Ugolini. Public health is attempting to use children as pawns to gain their parents' compliance to surveil their personal private medical records, especially vaccine status records, to attend publicly funded schools in Ontario. If you'd like to learn more and push back against this mandated surveillance by public health, head on over to our special website at stopvaccinecoercion.com. There you can watch the reports and support this work by signing our petition. That's stopvaccinecoercion.com.